And we can talk about this now to the co-chair of the Blood Inquiry Report. That's Professor Katharina Hauck. Thank you very much for being with us. First of all, Katharina, I know you were charged in particular with looking at the overall damage that this whole scandal did, not just to the individuals who were concerned, but to the country's health system, to the whole of the United Kingdom. In fact, what? Just in a nutshell, what did you say about that?
Yeah, so we were commissioned by Sir Brian Langstaff to contribute one part to the inquiry's report that was published in May this year. And that was really the assessment of the economic and health damages that arose from that terrible disaster in the 1980s. And we did a modeling study in order to find out what the aggregate burden was, because that was kind of our brief. So we found that if you aggregate the damage together to the NHS in terms of health and social care costs, but also to patients, then that was between 900 million and 1.6 billion. Now, this is over 51 years of treatment of patients of varying, some very severe illness. We also calculated more widely what were the financial and economic impact for those who were infected and also for their families in terms of lost work, lost productivity, lost earnings. And we estimated that this amounted to between 900 million and 2.6 billion in damages over the 51 years. And lastly, we looked at the life years that were lost. And these are lying between, in the aggregate, 70,000 and 200,000 healthy life years that were lost. So just as a comparison, COVID-19 cost in the Netherlands 60,000 life years. So quite a significant damage.
Yeah, so huge damage done by all of this. Just in terms of the compensation, what are your thoughts? Because we were just hearing in that report, some of those who are in line for compensation are saying, well, why should we get only half if we're a hepatitis C sufferer, half of what an HIV sufferer is going to get? In other words, the compensation levels and payments are different for different individuals. Now, is that right? Or, as one of the interviewees in that report said, treat us all the same, level it up so that everybody gets the highest payment?
Well, I mean, I was not part of the compensation framework study that Francis was tasked with and who worked out these payments. I think it's important, and I think a spokesperson for the past government said it's important not only to compensate for the harm that was done, but also for the wrong that was done to people. And I think it is, it's a shame that it has taken so long, whereas in many other countries, these inquiries and compensation schemes and so forth, they were set up in the 1990s. And why it took so long in the UK, that is really regrettable because many of the affected individuals are not around anymore.
OK. Professor Katharina Hauck, thank you very much indeed, co-chair of the Blood Inquiry Report. Thank you for your time.
Thank you. Pleasure.